Thank you very much. Imagine a ward with 40 newborn sick babies needing care, and they have 2 nurses wanting to give that care, but they cannot because they do not have appropriate tools. I have lived that experience. I know that experience. My name is Gloria Karirirwe. I'm a physician and a co-founder of NeoServe and Autothermal from Mbarara, Uganda. Hypothermia is low body temperature. It's a silent killer of newborn babies. In sub-Saharan Africa, a significant number of newborn babies experience low body temperatures, and low body temperatures cause severe complications such as pneumonia, low blood sugars because the babies are not feeding, and then in turn they get poor weight gain. Low body temperatures will often go unnoticed in busy hospital wards like Mbarara Regional Referral, where I worked, where 2 nurses are looking after 40 newborn babies, among other babies also on the ward. They are also carrying out other duties, giving prescribed medications. So my team, NeoServe, have developed a device called Autothermal that has 2 components. It has a bracelet that continuously monitors temperatures, and also a central display. So our device will help in solving the issue of understaffing and overload of work in a busy ward. The bracelet is worn on the baby's arm under the axilla and continuously monitors for temperature. It can be worn independently outside the hospital, and it will show low temperatures, normal temperatures, or high temperatures. Inside the hospital, it can be paired with the display, and vitals are sent by Bluetooth wirelessly to a central display, which is placed in an area like a nurse's room where nurses can congregate. Normally, when you go to Mbarara University Hospital or Mbarara Regional Referral Hospital or hospitals in low-income areas, there's normally a central room where nurses will do their documentation, mix their medicines. So in that room is where this display will be, and this display can have bracelets, like 60 bracelets that are connected from 60 babies, and they're displayed. And if there's a baby that has an irregular or abnormal temperature, there is an alarm that will go off, or a change in the color of an icon, and this will trigger a health worker to go and assess the baby and provide thermal care. So currently, NeoServe, my team, we are planning for an observational prospective study in November. We are going to recruit 8 healthcare workers and 60 caregivers or parents from 2, thank you very much, from 2 hospitals in southwestern Uganda. We are going to use a prospective study to minimize bias, and we are going to have 2 objectives: to assess the use of autothermal by healthcare workers, and 2, to compare autothermal to the gold standard thermometer. We hypothesize that autothermal is going to have 80% accuracy to the gold standard. And to achieve this, we would like to call upon you to support us. We are looking for partners to have good science, to publish good science, to to scale our solution. I would like to thank Nest360, Rice360 for giving us this opportunity to come here and talk to you about our solution. And we have an amazing team. I have an amazing team of a pediatrician. We have a product design manager. We have been in contact all these last 3 days. We've had an amazing time here. And we hope that at the next conference, they can come here and interact with this great community and share our results from our study. We would like to acknowledge our current partners, Vilgro Africa, Bara General Referral Hospital, MAST, Bara University of Science and Technology, ISME, ISHO, and thank you very much.
Been to your hospital many times, so I know that busy place. A question about how would you identify which babies have which armbands?
How would we identify which babies have?
Yeah, you've got 40 babies in your ward. You go and put these armbands on. How will you know? How will you link that armband to a specific baby?
Each baby will come in and we'll link the armband to the bed. Each baby has a bed number and the band is attached to the bed number.
It can get confusing, okay.
Yeah, it can get confusing, but we are attaching the bracelet to the bed number and the registration number in the hospital.
I'll ask a quick question. Are these locally manufactured? What do you estimate would be the price for one of these bracelets?
Thank you so much. So these are locally manufactured. We are manufacturing the casing locally. We are doing that locally, but then we've had a bit of challenges having development partners for the PCB, and that one we are outsourcing because our country is still young in developing. For the bracelet, we are looking at $15 outside a hospital, outside the government. And then when you're inside the hospital, it will be $12.
Joe.
Thank you for your presentation, Gloria. I had a couple of questions in terms of, I don't know how long you've used them for, so what time period you've trialed them over. I wondered whether there's been any adverse events in terms of whether there's been any skin damage. I don't know what it's made of, so I don't know what the material is. And then I also wanted to find out whether you have any idea how long they last. So what's their lifespan? And you may not know that yet, but just in terms of thinking about scaling and sort of using it and the lifespan of it, what's their lifespan?
Yeah.
Because if people are going to invest in it, they'll want to know how long it can last and whether it's worth investing in it.
Thank you very much. So we have the product and we are going to do a study, the first study, the observational study. Our product is made out of plastic ASB, the outside the casing. The battery life is 24 hours. We do not know, I do not know. I think the technicians, the engineers know how long the lifespan is. I will get back to you on that. So we are using, the plastic that we're using is hypoallergenic. We got feedback from the pediatricians and other designers on what materials we should be using for that. We actually had to do an iteration on the fasteners for the first bracelet we did. We had another material that we're using for the fasteners, and then the pediatrician said, I think it's better we use Velcro to fasten the bracelet. So we've been having back and forth before we go and do the study. So we are hoping that after the study in January, after we've completed the study, we'll have more feedback and we can incorporate that and share this science with you and hopefully other people.